Hello, everybody, and welcome to another episode of the Surdentity Podcast. I am your host, Elizabeth Dewar Anthony, and my guest today is the beautiful Heather Abernathy. And you're my first guest completely out of the dental realm.
Hmm.
And you're an anesthesiologist, and
Correct.
I saw your presentation on polyvagal theory for healthcare providers. And I talk quite a bit about the vagus nerve and trauma in my talk about roots of dental trauma. And I think it's really, really important for dental professionals to understand the role of trauma in these patient behaviors that they're complaining about on Facebook. And the role also of the vagus nerve, which is hello, right here, in also in trauma. So yeah, just tell me about polyvagal theory for healthcare providers.
Sure. Well, I'll start by saying that I did dental care for 15 years. So I did general anesthetics for pediatric dental and also for adult dental for 15 years, once a week. I did that. So I have
Wow.
a lot of experience with people who are afraid, who are fearful, um,
Wow.
and
That's awesome.
parents who are um, also very, rightfully concerned about their children. So I have a lot of experience with that.
Amazing. So and just, as a side, these pediatric dental disease is on the rise again. It was going down for generations and now it's on the rise again with these ridiculous sugar-filled diets that kids have and mouth breathing. Mouth breathing is a major factor in pediatric dental disease, and it's also a major factor in pediatric dental trauma because these kids go to these offices. It's like Disneyland, but they're still being traumatized because they can't breathe. Their airways are, their little mouths and their airways are so tiny. And even though everybody wants them to have a good experience, a lot of times they end up not having one because of their mouth breathing and airway. So let's just again tell me about polyvagal theory.
Well, I use it a lot in how I view my interactions with patients. I mean, I
Mm-hmm.
think I have, as an anesthesiologist, I have a lot of training in helping keep people safe, right? We
Yeah.
have protocols, we have algorithms, we have simulations. In my years of training, I never had anyone talk to me about how to help someone feel safe. And really, that is what I love to talk about.
Yes.
And I often meet people right before they go to surgery. So they
Mm-hmm.
have never met me before. It can sometimes be 5 minutes before they go to surgery, which means I have a very short amount of time to interact with them and help them feel safe.
Yeah.
And a short amount of time can make all the difference.
Yes.
Yes. And just a few minutes of interacting with someone can put them at ease, lets them know you see them as a person, lets them know you see what their concerns are, and that you take them seriously. And I think that's the same for dentistry. You don't need a lot of time to build that rapport. It can be very,
Yes.
you just have to, I say this like jest because it's not easy, but you need to be present with yourself and your
Mm-hmm.
body. You need to be in the moment. You need to be grounded. You need to be able to hold that capacity to be with another person.
Mm-hmm.
You have to have done your own work to allow yourself to be present and to know what you need in order to sit with someone and stay regulated yourself with someone who's dysregulated. And that takes work. But over time, it becomes your default.
You know what? That's amazing. So they don't teach any of this in dental school, and dental hygiene school. It's all about technology. It's all about the, fix, 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 and get in there and fix what's wrong in the mouth. And in the dental profession, substance abuse, suicide, depression, and anxiety are very high because of we're working in this tiny little space, and we are aware, and patients literally tell us, I hate being here. So what I've had to learn, and the one of the core values of Surdentity is um, not to take any of that personally and to approach the patient just as you described, and be present and be non-judgmental, and let this person know you are safe with me. And you're exactly right. It doesn't take a lot of time.
No, it doesn't. And that's where I think about trauma-informed care. If you practice trauma-informed care, which I'll go over the concepts of it, it actually is helpful for not just the patient, but for the provider. Because
Mm-hmm.
come from a trauma-informed care lens, you realize that this person's behavior is not about me. I don't need to take it personally. You also realize that all behavior is communication, and you start to ask, what is this person communicating?
Mm-hmm.
Then you can be curious.
Mm-hmm.
It doesn't kind of land on you and stick with you all day long,
Yep.
which wears the provider out and leads to burnout and substance misuse and anxiety and depression and all of those things. And trauma-informed care, it has kind of four key concepts. One is realizing the widespread impact of trauma, that we almost everyone comes with some kind of trauma, and using universal precautions.
Mm-hmm.
Everyone is a trauma survivor, right? Recognizing the signs and symptoms of trauma. And that's
Mm-hmm.
the polyvagal theory to be helpful, that we have different categories of, how we may feel in our bodies. Now, everyone is different, but you may have someone who's in a sympathetic mode, right? That's the fight or flight. That's a hyper aroused, like I
Yep.
can't, I need to move, right? I need
Yes.
to fight, I need to get away. And often their bodies are bracing.
Mm-hmm.
It's very metabolically demanding. Or you may have someone who is in kind of this shutdown, overwhelm, like the world is too much mode,
Mm-hmm.
where they may not make eye contact. They may feel hopeless, helpless. They may feel numb, actually. They may dissociate. Maybe they're
Yes.
there, right? And
Mm-hmm.
there are different things you can do just by recognizing that these behaviors, they all make sense.
Mm-hmm.
Then you can recognize those things, and then you can resist, is the third R, which is resist re-traumatizing these people. Resist having a tolerable stress become a
Mm-hmm.
toxic stress, where that,
Mm-hmm.
it takes a lot to recover from that. And then you put all of this, you respond by putting this into your policies, procedures, and practices. And those are the four R's, like realizing, recognizing, resisting, and responding. And it really, if it can work for your patients, your providers, your employees, your colleagues, you see a big shift, I think, in people's just attitudes towards work and towards each other.
That's amazing. And I don't think that in the morning huddle in the dental office, it's about, uh how much income are we producing today? And Mr. Jones is coming in. Oh, he's a big pain in the butt, and that kind of thing. But just those four R's, okay, everybody, let's remember everybody's coming in with some sort of trauma. And I love universal precautions. That is amazing
Mhm.
because we assume that people walking in want to be there and that they're in some sort of good mood and that they feel great, and they don't.
No.
And
As someone who gets my dental care, no, I don't like going to the dentist at all. And there's things that not that I am pretty vocal about advocating for myself,
mhm,
but these are things that I feel like should be offered to everyone. One is when I come in and they put me in this chair and they want me to lay down while they're getting stuff ready. I don't want to lay down. Like, it is stressful to be laying down when
mhm,
everyone else is sitting up. It's actually a very vulnerable position.
mhm,
If you sit up, you decrease the threat detection in your amygdala. So I just want to sit on the chair until it's time, until they're ready. And then,
mhm,
or I ask them, even if they're not doing x-rays, and now they know, they bring the x-ray gown into the room and they
mhm,
put it on me, even if
mhm.
it's during the cleaning, and it is like a weighted blanket
Yes.
surrounds me. And I just, those are things you can easily ask people, they're right there, you know, if they want to try that, it's very helpful. Very
Now,
helpful.
it is helpful, but you would be viewed as demanding and controlling and
Yeah.
a problem patient. And if someone commented about your behaviors in a dental Facebook group, they'd be like, "Oh, you need to dismiss that patient. They're a potential problem." And this seems to be the method of coping with patients like yourself who are in a fight or flight response
Mhm.
instead of what you just suggested. How hard is that to keep you upright until it's time to begin and to give you a weighted blanket? It's not hard.
No, and actually it makes me feel seen, and it makes me it decreases my anxiety, and I don't have like anxiety on a regular basis, but I go to the dentist and yeah, you feel disempowered.
Yes.
And these are easy things. I think what it makes me curious about is if that is what providers are thinking, it makes me think that they live in this fight or flight state,
We
right?
yes.
That they're when you're that quick to kind of not have much flexibility yourself,
Mm-hmm.
your day, or maybe you do something a little out of the ordinary, it makes me
Mm-hmm.
think you're like this, right? Like
Yeah.
you're like, I can't cope with something that's a
Right.
little demands a little bit more of me. So I'd be
Yeah.
curious about like that's I think why trauma informed care, the polyvagal theory is helpful because it's not we're all human, right?
Mm-hmm.
Like the patients have needs and the providers don't. We all do, and we all have these parts of us that need to be soothed and seen and acknowledged. And
Mm-hmm.
as so providers can kind of take a step back and be like, okay, can I be curious about this?
Mm-hmm. Well,
And
what you just described is, I think, across the board pretty common for dental professionals because of this dichotomy of trying to work in, all this technical work, right? It's very technical and you're working in this little space, and the dentist is, they're more like little engineers, right? They want to get in there and fix what they see as an engineering problem, and forgetting about, the mouth is attached to a human, and they focus on the teeth. And I'm really happy to see that there's a trend in my profession of, coming out of just the mouth and understanding that the mouth is connected to the body. And
yes,
and the oral systemic connection is a big topic, and also airway is a big buzzword, but there's still a disconnect, um, because airway is, it's almost like a marketing term, like, oh, we're airway, but dental professionals fail to understand we are working in the airway, whether we think we are or not. So we have to be cognizant of the patient's uh, reflex. It's not even a desire, it's a reflex to protect their airway.
of course. Yes. Yes. Yeah. And our bodies are prediction machines. They're always predicting, right?
Mm-hmm.
They're making sense of they're trying to make sense of our sensations, what's going on
Mm-hmm.
in our body in relation to what's going on in the world at the same
Mm-hmm.
time. Right? So yeah, if you have someone in your mouth with your mouth open, your jaw gets tight, right?
Mm-hmm.
That causes your strap muscles are bracing, right? All of that impacts your body and how the sensations you're taking in. And then if you have water dripping down the back, which
Right.
you're trying to right, you're trying to do that while someone's working in your mouth, it can be very distressing. And that makes sense. It would be unusual if someone didn't feel uncomfortable in that situation.
Right.
Like I would worry about who enjoys that. Like that's just
Right.
not an
It's
experience that we look forward to.
no kidding. It's, and enjoyable, but even there's not a lot of people who can tolerate it. And but there's this contempt
Mm.
among hygienists that I see in Facebook groups about why can't they just swallow? Or why do I have to use the suction all the time? And it's like, for one thing, you can't swallow and breathe at the same time. For
Mhm.
another thing, why are you so upset about this? Just suction.
Yeah, I think that's where I get curious about the providers also. Like there is clearly a stressor for them, right? And that
Mm-hmm.
it sounds like maybe they're at their limit of what they can manage. So what is going on in the office? What is going on in their home life, right? We walk into the office with our own trauma and our own,
Mm-hmm.
we don't necessarily check those at the door. How we interact with our patients is very much impacted by our own experience, right? Our concepts, our implicit biases. And so I would be curious, right? Like, where is that coming from? And what is the culture of the office and who set
Mm-hmm.
that culture? And how do you shift that culture?
That, I was just talking with a dental friend today about that, creating a culture of love and acceptance.
Mhm.
And that's the challenge,
Well,
is
it can be a challenge if if we don't have that for ourselves, if
right.
we're very critical of ourselves, if we are demand a lot of ourselves, if we're perfectionists. I mean, that yeah, those are old stories that can be hard now to just build an awareness, but that's the start is to build an awareness of
Yes.
where did it come from. I'm just curious, where did this come from?
Yeah.
And be able to look at that. Hmm.
Awareness, right? Awareness, acceptance, action.
Hmm.
And it's I don't know that I'd ever get any clients, but maybe to go to a dental office and sit down with the staff and say, look, what's going on here? You know,
Yeah. Yeah, that actually with trauma informed care work. So trauma informed care was first, I think, it was early 2000s that it was defined. So it has a term, and that was defined by SAMHSA, which is the Substance Abuse and
yep.
Mental Health Services Administration, right? Probably the biggest federal agency you've never heard of.
Oh yeah,
And
I've
you've heard of them. Okay. Yay. Um,
heard.
that that is one of their recommendations is have a patient panel. Like actually have a day where you sit down, you invite patients in, maybe patients who have challenges, and you have a discussion and just hear
Mhm,
their feedback. Or, call them on the phone, get their feedback of what is your experience like and what could we
mhm.
do differently.
Wow.
So yeah, you are on the right track there.
So, wow, that's amazing. But like I say, I don't know that there's too many offices that be calling me up like, look, we all want to, get on it. We all want to be more loving or whatever. And the thing is, I think people do want to be more loving, but it when you walk in and you have this schedule that's really full of these people that you have to do these procedures on, it can, yeah, you weren't in a hospital, so it can be very overwhelming.
Yes. I
But
have to always, and I'm not always like this, but I try, I guess, to regularly do I check myself pretty much
mhm,
before I walk into a patient's room. I do a quick body scan, right? Like I'm talking seconds. This is not
mhm,
something a lot of time, but it's just, okay, what do I notice? What do I need? Okay, maybe I notice that there's a tension in my shoulder.
mhm,
In this little bit of time, what do I need? I'll take a breath in, and on the exhale, I'll just breathe into that constriction and it'll loosen a little bit. Or even just an awareness of like, oh, I am stressed and I am angry from this interaction I had earlier with the surgeon or whatever. And I just bring an awareness to that, right? And I take a long exhale, activating my parasympathetic nervous system. Sometimes I push that breath all the way, my feet into the floor. I find myself in the moment, and then I go in, right? It's
mhm,
just, if I just walk into that room and I barge into a room and I'm like this, I'm going to just
mhm,
spew that all over that patient. And so,
mhm,
how can which doesn't help me, right? It just keeps this activation going.
Exactly. And so serene dentistry, I base that word on the serenity prayer.
Mm.
And the think courage to change the things I can change myself.
Yes.
And what you just described is exactly what I'm trying to get across to my fellow professionals. It doesn't have to take a lot of time, but we can do something to approach our patients with this calmness.
Yes, and you will then, as you described earlier, that the providers take on that we know our patients don't want to be here. They say they hate coming here. What you'll start to experience then is the opposite of that, of people saying, this was the best experience. Thank you so much for doing this, or I really appreciate what you did today. And those things, those also stick with us.
Mm-hmm.
We go home feeling more satisfied, more content, and more willing and eager to come back the next day.
I've had the experience of walking into a dental office to substitute for a day and having patients say, "Oh my gosh, thank you so much." I'll bring them out to the desk and after the patient leaves, they'll be like, "What did you do? That's our like worst patient. They always complain." I'm like, I don't
And
just,
what would you say that you did?
I just do what I do. I just approached with calm, with
Mhm.
non-judgment, with a pleasant, non-judgmental demeanor. Not like super well in the morning. Sometimes when the caffeine hits, I can get a little, and the patients are like, "Whoa, it's a little too positive," but you know, yeah, that pleasant, calm demeanor,
Mm.
and that didn't happen on accident. As a matter of fact, I was suffering quite a bit in my early career. And I would, at the end of the day, even though I treated people nicely all day, I would be exhausted
Mhm.
and in pain. And then I would have to go home to my husband and daughter. And it was, oh, so, and this, surdensity coincides with, my
Mm.
recovery from alcoholism.
Mhm.
And all the ideas that I learned there, I started to apply to as I started to care for myself and started to, try to live that serenity prayer. I started to realize that, wow, there's something I can do here.
Mhm.
And that helplessness, that helpless victim mentality, I think is an affliction in a lot of dental people. And it's not their fault, but they come by it honestly, but you can also do something to alleviate that.
Mhm. And what do you how do you practice that?
uh you know um meditation and prayer and meditation,
Mhm.
um just trying to stay centered, bring myself down, and then try to stay grounded. And we're all human, and there are some times where you know you've I've just had it.
Yeah.
But that's the time where I have to, just like you said, let's do a little scan here. And, what can I do to adjust myself so that I can see this next person with certainty?
Yes.
Yeah.
And it's not about always being in a calm space.
Right.
That's not it. That's not what we're going for. There are times when if I have an emergency, I need to mobilize. I
Mm-hmm.
need to be in a sympathetic state. I need that.
Mm-hmm.
And I need when the threat has passed, I need to get out of that state.
Mm-hmm.
That's what toxic stress is. It's when it's this chronic, pervasive stress.
Yeah.
When our bodies, having cortisol, adrenaline running through your body on a regular basis. I mean, we were made for acute stressors
Mm-hmm.
and to return to a calm, regulated state, not for this chronic stress. And that takes a toll. It's an allostatic load, right? It's the wear and tear on our body from this chronic stress. And so it's learning to be a little more flexible with your nervous system and how you respond. And I
Mhm.
think having building an awareness and building some of these skills allows you to respond instead of react. And
Yes.
that gives you agency. It gives you agency over your life, and it
Hmm.
gives you agency over how you feel.
Yes, exactly. Agency. You know what? That's I realize now just thinking about that word, you know, I come from a background of, chaos,
Mm.
uh dysfunction, and so I didn't really have a lot of agency. I didn't grow up with agency.
Mhm.
So that's a very familiar, no agency is kind of my default setting.
Mhm.
And but just like a default setting, you can change it. And
Yes.
wow, oh my gosh, wow, I love when I it's like a spiritual experience I just had. Um, realizing that, yeah, wow,
And we can give that to our patients, right?
yes.
So safety is big, right? How can we let our patients know that, like, how can they physically in their physical environment and like psychologically, how can they feel safe, right? And this is again what's going on around them, right? A weighted blanket, can they sit up if they don't need to be lying down? Um, and just how you talk to them, right?
Mhm.
Contact, things like that. And then agency, giving them choice, recognizing that people are experts in themselves and how can I give someone more choice? And that really makes a big difference. For me, like an example is when I need to start an IV, I ask the person, what hand would you like me to take a look at? Like
Mhm.
anytime I can give someone a choice, that
Mhm.
empowers them. Anytime someone is empowered, they feel safer.
You know what? That kind of goes against what you were I agree with everything you just said, but it kind of goes against the grain of that authoritarian model of, I'm the practitioner, I know more than you, you know, um,
Yes, it sure does.
and yeah, right. So
It
these
sure does.
patients, oh, what did you just said? Oh, they're expert in themselves,
Yes.
and
They
a
have
lot of
skills,
the
right? They have skills, they have abilities, and
right.
maybe where you're seeing them, they feel terrified and they regress a little bit because they're scared and they act differently than they do outside of your office.
Oh,
But
absolutely.
hmm
But there's a lot of, but this idea that patients are experts in themselves goes against that authoritarian medical model, because that patients who present as if, present with, well, I'm an expert in myself, they, again, they're viewed as problem patients, you know, because we, this is very pervasive in the dental field. We are the experts, we know what you need, and you need to do it, and if
uh,
you don't do it, then I'm going to dismiss you.
yeah, that's an that requires a paradigm shift, right? It requires a paradigm shift, and paradigm shifts take time.
Yes, they do.
And they take things like what you're doing. They take talking about it, they take education, they take awareness and the paradigm shift, right? Again, under a trauma-informed care, you would not say what's wrong with you. You'd
Mm-hmm.
say what happened to you? What happened
Mm-hmm.
to you? Like how have you tried to deal with it? And you wouldn't say, here's what I can do for you. You'd say, how can we work together to meet your goal?
Mm.
That's a very different paradigm. Uh,
Yes,
but again, I think it's one that benefits both the patient and the provider.
I completely agree. It's win-win. It's
Yeah.
it it's better for, and when I come away from a trauma-informed care appointment, I feel better. I don't
Mhm.
feel worse.
Right. Because I think it allows you to see it allows you to see another person as a human, right? It's
Mm-hmm.
like humanity meeting humanity.
Right?
And that is going to be healing for both people.
Isn't that awesome? Healing for both people. You know, that's kind of always in the back of my mind. about, as I help you, I'm healing me. And what better possible outcome could there be
Right.
than a mutual healing?
Mhm.
Wowie wow. Well,
Yeah.
I've already had like two spiritual experiences during our conversation. So, oh my gosh. And I love that you are, that you had have experience in dental, and you have experience as an anxious dental patient. This information is so important for my fellow professionals to hear and understand. And I'm sure sometimes I sound a little judgy of my fellow professionals. And it's a character defect, right? It's my impatience, or whatever you want to say, my grandiosity. But I'm just so happy that I talked to you today.
Yeah, it's really nice talking to you, right? And if we can all come away with being a little more curious about each other and our behavior, and right, that's that's a win.
It is a win. So thank you so much for spending this time with me this morning. And I was just in Sun Prairie over the weekend.
Out.
It was beautiful weather.
It was hot, but yes,
No, it was
that's
not. I have to get to Culver's. Every time I go out there, I have to get to Culver's because I got to get my cheese curds and my ice cream. So yes. So thank you so much. And I'm so glad I found you.
it's really nice to be able to talk to you today. Thank you.
Have a beautiful rest of your day out there in Wisconsin.
Thank you.
And say
You,
hi to Wisconsin for me. It's a fine state.
it is. Yes. All right. Thank
Thanks a
you.
lot.
Bye.
Bye.